This is an SMSI Healthy Living Solutions and SMSI Urban Call Marketing production.
We're following breaking news on the new coronavirus in the Triad.
The daily COVID toll remains relentless.
Cases of community-spread coronavirus here in North Carolina.
A person from Forsyth County has died related to the virus.
Forsyth County Commissioner Fleming Elamine heard about the public's concerns around how the testing feels and volunteered to take us along with him as he went in for a COVID-19 test. He moves up in the line and is given supplies like hand sanitizer and a free face mask, and it's on to the swabbing.
I'm really honored to be here, to be a part of this vital effort, because our foundational asset we have in our community is healthy living. Falls right in line with your theme, especially given what we're dealing with now with this COVID-19 pandemic that we're suffering. And we're suffering, unfortunately, across the country, larger degree than the general population. So this effort that we're engaged in is vital because it's a matter of life and death. Sadly, in our community, the greatest numbers of infected residents are in the Hispanic community, hovering close to 50%. Next in that line, of course, is the Caucasian community. Third is the African American community, and then it descends from there. But for our habits and our lifestyles, it's critical because it really is a matter of life and death. Healthy living habits has to continue beyond COVID. Hopefully for some of us it was before COVID, and we'll be able to restrain or refrain from being directly impacted if we maintain a healthy living style. So it's very, very critical. And the work that Mr. and Mrs. Jones are engaged in really is like a heartbeat to our community, because they remind us how important it is to have healthy living habits and our daily life to reflect that in exercise, eating habits, and our social habits. So this is very, very vital. And I mean that seriously when I say it's a matter of life and death. I've had, unfortunately, very close friends of mine who live in Cleveland, Ohio, to die in pairs, husband and wives. One received the COVID and they both went to the hospital in one case. The father was sent back home. The mother stayed, or the wife stayed. She died 3 days later, pardon me, and he expired 6 days later. And they've been married for 45 years. So, and it impacts, and they were somewhat elderly, but it also impacts the young as well. So when you look at those brutal statistics, when you look at the disparities we already have in our community when it comes to health matters, whether it be the sad case of increasing diabetes, you can go down the list, asthma, etc. We unfortunately represent the greater numbers in those regards, generally speaking. So for that reason and others, it's very critical that we be engaged in a very attentive, grassroots approach to dealing with COVID-19. And I think what this organization has done historically, with a proven track record to reach the people who need it the most, represents one of the best efforts we can have here in Forsyth County. But again, I'll conclude by simply saying that this is vital. It's vital because it is a matter of life and death, and we should take our lives very seriously, our children very seriously, and grandchildren, and make sure they're aware of the pitfalls of this COVID-19 and how to avoid it, and what to do if indeed you're unfortunately infected by it, what precautions you can have. And if you're blessed to come out of it, how do you change your habits to be oriented more toward healthy living in your day-to-day lifestyle? And by all means, start that now instead of waiting until then to pursue that kind of change in your behavior.
All right, so this is really the mission, what we're trying to accomplish here. I will say public health's most effective weapon, if you will, the nuclear weapon that we have is community engagement. If we want to improve health in this community and to reduce the barriers that exist in social health determinants, which social health determinants are items that help determine outcomes, and there are a whole host of things. So this is our target mission, our target market for this mission. The African American community, primarily in 27105 and 27101, using the vast network that Lafayette and Sandy have, and all of you throughout the community. And that target market, again, we're out to expand the knowledge on COVID-19, specifically in prevention activity. All right, so this is the way we prevent it. I'm sure everybody has heard of the 3 W's. I know we've been spewing it as much as possible. The state's been spewing as much as possible. We've been really focusing our campaigns on the 3 W's. So quite frankly, it's wear a mask, maintain that social distance, I'm going to say 6 feet or greater from person to person when we can. When we're in the stores or other places out in public, I know it could be hard to do, but we really have to be cognizant of aware how close we are to folks out in public or even in the home. And wash your hands frequently, at least 20 seconds with soap and water. If you don't have soap and water in front of you and you can't wash your hands, try having that hand sanitizer greater than 60% concentration of alcohol on you at all times if possible. All right, so testing, where to get testing. The best thing I can do, this is evolving, this updates every day. We just added 10 testing locations last night, so this is how fast that we're trying to move folks in our testing. Our testing in public health has really been focused 27101, 27105, 27107, 27127 over the last couple months, where folks can get the most up-to-date information on testing or events in our community that are occurring is on the county website at www.forsyth.cc/COVID update. There's testing information on there. There's flu shot information. There's case counts, but folks can learn where they can get their test in the community. And the ones that public health do, we don't ask any questions. You come, you say you want a test, you get a test, no hands down. And the test is no cost to the individual.
And now a few words from Sandra Miller-Jones and Lafayette Jones.
We've got 2 companies. One is Urban Call Marketing that Lafayette heads, and the other is SMSI Healthy Living Solutions. It's a new name for us because we've started to focus much more on improving the health of our communities. We've been around now for 40 years, a little over 40 years. We started out in Chicago and moved here in 1990. Came back home. This is my home. I'm so glad to be back home. We came home with our daughter, Bridget Miller-Jones, who's now Dr. Bridget Jones Brooks, living in Atlanta, Georgia. Atlanta is one of our key markets. Our client list includes many top national brands. We've worked for lots of folks over the 40-year period. We've been trying over the last, 5 years now to focus more on North Carolina-based entities because we'd like to stay home and we'd like to help our home folks.
Urban Call started as a newsletter that we put inside the gift bags of free product samples. And people kept writing in saying, those are good. And they're just single sheets of paper. And as when we didn't do sampling, they would write letters and say, "Where's the newsletter?" We said, "We don't have a newsletter." What newsletter? We've done about 100 million of them so far. Some we've done in Spanish. We've done a Korean one. We're bilingual for real, ambidextrous. We do a lot of beauty because we're beauty people. These are 4-page supplements. This is one we did with Magic Johnson. We toured the country with him.
You see, we're in the major cities and major territories across the country.
And Sandy's being very modest. She and her 10 people have signed up more than 3,000 people. And every season, and I'm one of the people responsible for marketing, we reach more than 500,000 people through various devices to make them aware. People lose their job, Sandy and her team can help them. If they need affordable insurance, you can help them. So, end of story.